Hi, and welcome to Kidney Plugged In. On the show today, we are very pleased to have transplant surgeon Dr. Mike Moser joining us via Zoom from Saskatchewan. He's here to talk about the importance of organ donation registration and the benefits of receiving a living kidney donor transplant. So stay with us because Dr. Moser is here next on Kidney Plugged In.
National Organ and Tissue Donation Awareness Week is held on the third week of April each year. Knock On raises awareness about the critical need for more organ donors across Canada. Knock On Week has just wrapped up, but the conversation about organ donation, whether it be registering your wishes to be a deceased donor or discussions about living organ donation, continues to be an important conversation with your loved ones. We are so pleased that joining us on Plugged In today to talk about kidney transplant and living kidney donation is transplant surgeon Dr. Mike Moser, who sits on the board of directors for the Saskatchewan branch of the Kidney Foundation. Thank you for taking the time to join us on Plugged In today, Dr. Moser.
It's great to be here.
Dr. Moser, from 50 to 75% of all kidney transplants are from deceased donor kidneys. What are some of the benefits of a living kidney transplant?
That's a good question, Susanna. To somebody who is waiting for a kidney transplant, a living donor kidney transplant or a deceased donor kidney transplant is a life changer. It's a lifesaver. But having said that, there are a few advantages to receiving a living donor kidney. And to many patients needing a transplant, one of the most appealing reasons to pursue living kidney donation has to do with waiting time. When somebody's waiting for a deceased donor kidney, you're on a waiting list, and that can mean a wait of, well, on average of about 3.5 years, if not more. And we have, of course, people who wait 6 months and they get the call for their transplant. We also have people waiting 5 years, 7 years, and even somebody who waited 14 years on the waiting list before getting their turn. So with a living donor kidney transplant, if you have a willing, motivated donor who's extremely healthy, it's possible to get a date for your transplant within 3 to 6 months. And along those lines, another advantage is that a living donor kidney transplant is done as elective surgery. It's not done as emergency surgery. So the living donation is done during the day. We pick a specific date on the calendar over a month in advance. And we know that on that day, the donor will come in at 8 a.m., they'll donate the kidney in the morning, and right away after that, in the afternoon, the recipient will receive their kidney. And that also means that the kidney is out of the body for as little time as possible. And that's got to be good for short-term and long-term function. Another advantage is that a lot of living donor kidney transplants are from close relatives. And that means the matches are going to be closer if you receive a kidney from your sibling or from an aunt or uncle or from a parent. And you add up all these factors together, and it makes it such that statistically speaking, somebody who receives a living donor kidney transplant will have that kidney work for a couple years longer on average. Having said all that, deceased donor kidneys can be excellent, and whether a person receives a deceased donor kidney transplant or a living donor kidney transplant, it's clearly the gift of life.
Definitely, I can attest to that. So Dr. Moser, being a transplant patient myself, I'm post-transplant 12 years. So, when I hear the average is 13 to 14 years, my time is coming up to find a potential living donor. My question is do people go higher than 13, 14 years?
Yeah, I think that's the thing. It's a statistic, and we all know what statistics are. They're a lumped together average of a whole bunch of individuals. And definitely, we've got a lot of happy stories of people who have their kidneys for 25 years. I'm aware of one with 36 years and one who's been over 40 years with his.
That's amazing. I love that. Higher the numbers, the better.
We do too. Yeah.
Dr. Moser, what can you tell me about the surgery to donate a kidney as a living donor? I've heard some talk about a keyhole surgery. Could you tell us more?
Yeah, for sure. Keyhole surgery has greatly changed the way a lot of surgery is done, but it's definitely made living kidney donation a lot less onerous, a lot less difficult for the donor than it was in the past. And just as an example, in the old days, and by that I mean prior to 2008, 2009, in Canada, the majority of living kidney donations were done via open surgery. And this involved a very large incision, a very large cut, started on the front of your abdomen, worked its way around the side, what's known as the flank, and then into your back. And so for a living kidney donor, it was a long recovery, a big incision, quite uncomfortable. And with the keyhole surgery, which is also known as laparoscopic surgery, the keyhole refers to the fact that there's 3 or 4 tiny incisions, less than a centimeter in length. And through those little openings, it's possible to insert a long, tiny camera, and then use the other openings for tiny, long instruments. And with that, we can free up the artery, the vein, and the ureter of the kidney, free up the kidney, and then remove it that way. The largest incision, of course, we still need one that's about 6 centimeters in length, and that's to take the kidney out sideways. Interestingly enough, between 2009 and 2019, they noticed about a 30% increase in living kidney donation. And there's probably a lot of reasons for that. I'd like to think one of them is that the surgery to donate a kidney has become a lot less difficult for the donor, a lot less onerous for the donor, and that's led to that 30% increase in living donation worldwide. To the person who donates, it's a much faster recovery. It's usually a couple of days in hospital, and it's a faster return to work. Most people are back to work at 6 weeks, but depending on what they do, it might be as much as 3 months off work.
When I was on dialysis, I was quite young and I didn't have a voice, and I didn't know how to ask my family and friends to step up to be a living donor or even get tested. How do kidney patients find a living kidney donor, and how would you suggest they ask?
Well, there's a lot of things we ask for in life, and this has got to be one of the more challenging things to go out and ask somebody about. And I think what I've heard from a lot of people is it's not so much about asking people, it's about getting the word out. It's about informing your family and friends, having a conversation, telling them, hey, you know, I'm on dialysis. Dialysis is not great. It's keeping me going here, but it's not great. A transplant would obviously change my life. And, you know, there's living donation as possible. And, you know, did you know that if a person has 2 healthy kidneys, it's possible to donate one, and that'll make all the difference in the world in my life. And, you know, be informed, know the answers to questions that potential donors might have, you know a little bit about the surgery. And of course, have those contact numbers available. Make it as easy as possible for people to follow through if they're interested in donating. And, you know, obviously the transplant programs don't call the donors. It's up to the donors to call us. We've heard of people who are looking for living donors who actually give out little cards with the numbers, and we have some cards available. The number of the living donor coordinator to call to get the whole process started if they're interested, or even if they just want to find out some more information.
Well, I appreciate that. Definitely gives me more encouragement for when the time comes, if I ever need a second transplant. So thank you. Dr. Moser, from the first year of Kidney Walk campaign, you have been a dedicated supporter of Kidney Walk. In fact, since year 1, you've laced up your sneakers and joined our enthusiastic kidney and transplant community that raises the much needed awareness about kidney disease and organ donation. Do you mind sharing why Kidney Walk is such an important event for you to be involved in?
Yeah, definitely, Susanna. It's one of these events that I look forward to every year. And I think there's a lot of reasons for that. There's this incredible sense of community taking part in the Kidney Mach each year. We are the kidney community. And I'm a big fan of stories. And I mean, there's a lot of stories there, whether it's informally, person to person, or whether it's the formal presentations. There's stories of hope for people who are waiting for their chance. There's sad stories of loss from donor families that attend, who have lost a loved one who has donated to help save the lives of others. And a lot of stories of thankfulness, thankfulness to those donor families and to living donors for the people who have received their kidney transplant. And for me personally, it's also a chance to see the result of these transplants that our team has participated in. To see these people outside of hospital, to see them back to normal, to see them thriving. And really, after the Kidney Walk, every single year I've been a part of it, I go to work that next Monday, and I'm just full of inspiration, full of energy, ready to get back to work and put in as many kidneys as we possibly can.
I appreciate that, and it's amazing to hear. I personally have been involved with the Kidney Walk since my transplant. And the walk is such a community event to meet one another outside of getting blood work or doctor's appointments.
Well, hi, Robert.
Hello.
How are you today?
Oh, I'm fantastic.
You know, and see people thriving. And I recall the last Kidney Walk before COVID hit. I will never forget this, that 3 people received the gift of life at our Saskatoon walk. And the year before, they were all on dialysis. And it was so amazing to celebrate those 3 individuals that received the gift of life. That's a memory I will treasure forever, just to see the difference that in them, you know, walking longer, just smiles on their faces.
Love it. Those are great stories. Absolutely.
Last year, due to the COVID pandemic, the Kidney Walk campaign went virtual for the first time.
Welcome to Walk the Block, the first ever virtual kidney walk being held.
How did you find participating in first of its kind in the Kidney Walk campaign, Walk the Block?
Well, I gotta say, I was super impressed at the ingenuity, the imagination, and all the hard work of the organizers in putting this on. Because at first I was skeptical, I was skeptical that they'd be able to recapture that sense of community, and yet they did it. We still had lots of great stories delivered virtually.
Singing in the rain. And why are we singing in the rain? Because we're walking for the kidneys. Woo-hoo!
Stories shared from people from across all of Western Canada. And there's definitely that sense of community. And I found in the end that I went back to work that following Monday just as energized after the virtual event as I had been with the in-person event. There was one thing though that I missed, and you'll know what I'm talking about, Susanna, and that's the moment during the in-person, let's say, Kidney Walk, that incredible sight of seeing 100 people or 200 people walking alongside the river wearing the same colored shirt. That great symbol of all of us united together as a kidney community against kidney disease and in support of organ donation and, raising awareness, raising funding. But what an awesome sight that is. And I really look forward to being part of that again, hopefully next year.
Dr. Moser, how has COVID-19 impacted the transplantation process? Kidney transplant surgeries and surgeries for living kidney donors?
Yeah, I mean, this past year and a half has had a tremendous impact on everybody on this planet, but it's presented some very specific challenges to people with chronic diseases, with chronic kidney disease, and people with transplants. And the thing we got to remember is when somebody receives a transplant, not just a kidney transplant, any kind of transplant, they're all started on immunosuppression medications. And those are medications to, bring down the immune system so that the immune system is less likely to attack that new organ. So there's less chance of rejection. And the trouble with being on immunosuppression is it leaves a person more open to serious infections, including COVID. We've seen that COVID in people on immunosuppression is very serious. And when the pandemic was first emerging, nobody really had experience dealing with a pandemic because transplantation hasn't really been around for that long. Nobody really knew what the right way to proceed was, and we saw programs completely closed down and not do transplants for about 3 months. We saw the other end of the spectrum where a lot of programs continued, say, business as usual, as they say. And then I think our program, we kind of took an in-between approach. And by just watching and learning more about the disease, seeing what was happening, very soon we realized that, we're already very cautious when it comes to preventing infections in our transplant patients. And, on top of that is the fact that transplant patients, they're already stars when it comes to hand washing, to their own form of social distancing, to reducing their risk of infection. And so very soon, as soon as we safely could, we got back to being fully open again as a transplant program. Trouble is between a combination of programs closing down for safety, and probably a reduction in the amount of donation and living donation surgeries. In Canada anyway, in 2020, there was a decrease by 20 to 30% in the number of transplants that took place. And we're open again now, but we do always have to be careful and see what's coming up, being adaptable and ready to adapt to whatever comes up.
I appreciate that. That's great information. And, I remember after my transplant, 2 years in, I went on my first international trip and I wore a mask on the plane. And I was so embarrassed. I was probably 27 years old. And I was like, why am I wearing this? But nowadays it's the new norm. So, it's just how times have changed. So thank you.
I'm all for it. I think I'm going to have a hard time getting on a plane without putting a mask on,
Yes.
From here on in, pandemic or no pandemic.
Dr. Moser, I'm curious, for those that have tragically passed away from COVID-19, is the transplant program able to save those kidneys and donate them to those that are waiting on the transplant waiting list?
Yeah, that's a good question. A lot of people have been asking that very question. And I think the simple answer is unfortunately no. When it comes to transplantation, there's not a lot of absolutes, but two of the absolutes are that one cannot transplant organs that come from somebody with active cancer or with active infection, because essentially you're spreading the cancer or the infection to that person, to the recipient. And that would include infections like COVID. Obviously, if somebody had COVID 3 months before and, unfortunately passed away from something else in the meantime, then, that would be fine for transplantation. But if there's active infection and that was the cause of death, then unfortunately, all those organs cannot be used.
And I also have one other item that I've heard, and I'm just curious if you could answer this as well. For deceased donation, if someone passes away outside of the hospital, are they eligible to become a donor? Or I've heard they have to pass in the hospital.
I think you're right. It has to be done in the hospital. As soon as a person's heart stops, the organs are no longer getting blood supply, they're no longer getting oxygen or glucose. And so the cells in the organ very quickly, within 10, 15 minutes, the cells in the organ are dying off. So you're absolutely right. It has to be in a hospital setting that they pass away.
If someone is interested in learning more, becoming a living kidney donor, what are the first steps? And can anyone be a donor?
I think to answer your second question first, anybody can inquire about being a donor. I think there's all too often the opposite is true, where people will assume, they'll say, I'm too old to be a donor. Nobody wants my kidney. After all, I'm 55. That's far from the truth. So, I think we'd encourage people to look more into it, to make the call to the local donor coordination program. And there's a screening questionnaire. Very quickly, you can find out if it's possible you might be a donor or if it's really out of the question. These days, you can find a lot of information on the internet. The challenge is finding good information, truthful information. I think we can safely say that the Kidney Foundation has excellent information about living donation, but generally in your local health authority, at your local hospitals, they have websites too that generally have very good and very truthful information to you.
So Dr. Moser, I hear you're going to be joining Team Sask Kidney March 2021. So it'll be taking place virtually for the second year in its 12-year history. You'll be joining over 400 participants from across the country who are taking on this challenge. So welcome to your first Kidney March. What are you looking forward to the most as a participant in 2021 Kidney March Team Sask?
The Kidney March is something that I've heard about for years, something that I've wanted to take part in for years. And, when you think about it, a walk through the Kananaskis, what better setting? But be that as it may, this year it's going to be virtual. And I still see it, though, as an extension of the Kidney Walk, maybe more of a journey together as a community, as a kidney community. And, again, I know we're going to hear all those inspiring stories that we're used to hearing at the Kidney Walk.
Susanna's kidneys failed as a result of lupus. when she was 20 years old.
And even though all of us are going to be apart, we're all going to be together. And I have great faith in the use of technology, like they had done for the Kidney Walk. And I'm just looking forward to a lot of lasting memories of this journey that we're all going to take together as part of Team Sask in the Kidney March.
I very much appreciate you joining our team, and I encourage others to join Kidney March and especially Team Sask. Can you share with us a secret tip or two on how you are planning or maybe already training for participating in your 100-kilometer journey?
Sure. Well, I do like long distances. I've been a runner forever. And I try and get out 2 or 3 times a week for a run. You know, I'm all set here. I've got my GPS. Yeah, it's very old school. It's got every kilometer I've run since I was about 25. It's great. It's the size of a brick, but it's one of those things. I think the thing that I'm most stressed out about is finding comfortable shoes. You know, 100 kilometers is a long way. And to boot, I think there's an additional challenge there. And let's just say I take my inspiration from one of our regular teams that we have on our Kidney Walk in Saskatoon. And that is the team known as the Sweet Peas. Think about it. And the great thing about that team is everything they wear is yellow. I'm not looking to take over their team or anything like that, but I'm going to see if I can find some good, comfortable yellow shoes. And it might not be the easiest thing, but that's what I'm hoping to do between now and the Kidney March.
Dr. Moser, what are some of the biggest myths around donating a kidney?
Oh, there's so many myths when it comes to organ donation and transplantation to start with. I think specific to living donation, the commonest one I hear is that somehow people think donating a kidney will shorten their life, will change their life in a bad way forever. And that's really not what we want. That's not what we've seen in Canada and around the world. They've studied thousands, if not tens of thousands of people who are living donors. They've followed them for 30 years after. They've found very, very little difference at all in a person's quality of life, in their medical problems, in their kidney function. Obviously, we have to do our homework and select carefully. We have to make sure we choose donors that are very healthy with no obvious risks for kidney disease. But if we do that, no, it should have absolutely no effect on your life. In fact, once you've recovered from the surgery, it should be possible to get back to a completely normal life.
So once they donate their kidney and they're eligible to go home, do they have any follow-up appointments?
That's right. Follow-up is for life, but I think most people should be seeing their family docs once a year for routine histories and physicals. And the follow-up after kidney donation is really not that onerous. It's not that different from a regular annual history, physical, labs, hair analysis, things like that.
Wow, that's very encouraging. Dr. Moser, I'm just wondering if you could explain or go through the process about becoming a living donor. Like, what does it all include?
Well, it is a process that can honestly take from 3 to 6 months. So it does involve a lot of testing. We need to make sure that we are not putting donors at any excessive risk. You know, we want to identify any problems that they might have down the line, perhaps. And, the sad truth is, or, it is what it is that about 50% of the people who present as potential living donors, we find something along the testing to rule them out. And that might be early on at the testing questionnaire, that very first phone call. It might be in some of the early blood tests, and it might not be until that very last CAT scan that tells us all about the anatomy in there. So we do have to make sure we're very careful. The last thing in the world we want is for somebody who's doing such a great deed as donating a kidney. We really don't want anything bad to come of that.
So unfortunately, I didn't have a living kidney donor step up, but I've heard a lot of people that have received the gift of life from a family member or a loved one, that sometimes they don't know if their family member even stepped up to donate an organ or to donate their kidney until they actually get the yes, and then they tell their family as a big surprise. So is it a confidential process?
Sure, absolutely. As a transplant program, we need to at all times keep the recipient sort of separate in our minds and our charts and that from the potential donors. And you're right, sometimes people have very secretly, very anonymously, without telling their family members, they've come forward as potential donors. They've gone through the whole workup, and when everything works out, then it's a great surprise to the recipient. And, but in the meantime, things can be very confidential. Every family has a different approach. And the other thing, of course, along those same lines is just making that phone call does not bind you to anything. You know, as a potential living donor, there's the opportunity to back out at any time. You could be done all of the testing. Everything might be just perfect. And if something doesn't feel right, it's okay. You know, if it doesn't feel right to the donor, it's just fine to back out at any time.
Can more than one family member or loved one step up to be a donor at the same time, or is it one application at a time?
I think in general, I can't speak for all of the provinces, but there is leeway to have, you know, 1, 2, or 3 donors, I think, in most provinces. Obviously, there has to be a limit. You know, it does take up a lot of resources. It is a lot of tests and a lot of time. But, you know, out of 3 donors, for example, a lot of times there may well be 1 or 2, or maybe all 3 will be very good candidates.
Dr. Moser, I very much appreciate your time and chatting about kidney donation and how one can be a living kidney donor. So I do appreciate all your time and talking about this and raising the importance of highlighting organ donation. Thank you.
It's been my pleasure. Thank you for having me.
So, and I'm at 12. Now I couldn't remember. Can you hear my dog barking?
Yeah. Sounds like he's done now. No, he's not done.
There's probably a lot of factors for that. Go away.
Glad it's not me.
It's the pre-vacation syndrome. Yeah.
Do you want me to call you again for an interview or lose your number? You said we could feature on speed dial. I think I on tape saying that. So,
I'd be happy to do this again. Had a great time.
That'd be awesome.